Esophageal cancer can be considered non-curable in many cases due to several factors that impact treatment effectiveness and disease progression. Here are 15 reasons why esophageal cancer can become non-curable. 1. Late diagnosis. Esophageal cancer often presents symptoms, difficulty swallowing, weight loss, pain only in later stages when the tumor has already spread, making curative treatment difficult. 2. Rapid progression. This cancer is aggressive and can spread quickly to nearby lymph nodes and distant organs, reducing the chances of successful treatment. 3. Limited early symptoms. In its early stages, esophageal cancer is often asymptomatic, delaying detection until it's too advanced for curative treatment. 4. High metastatic potential. Esophageal cancer frequently metastasizes to the lungs, liver, and bones, making localized treatments like surgery ineffective. 5. Resistance to chemotherapy. Some cases of esophageal cancer do not respond well to chemotherapy, limiting the effectiveness of systemic treatment. 6. Poor response to radiation therapy. Although radiation is used, esophageal tumors can be resistant, requiring high doses that may not be tolerated by the patient. 7. High recurrence rate. Even after successful initial treatment, esophageal cancer has a high chance of recurrence, often in an incurable form. 8. Surgical challenges. Esophagectomy, removal of part of the esophagus, is a complex surgery with high risks, and many patients are not eligible due to poor health or advanced disease. 9. Malnutrition and weakness. Due to swallowing difficulties, patients often suffer from malnutrition and weight loss, making them too weak for aggressive treatment. 10. Poor overall health of patients. Esophageal cancer is more common in older adults with comorbidities, heart disease, lung disease, making aggressive treatment unsafe. 11. Limited treatment options in stage 4. Once the cancer has spread extensively, treatment becomes palliative rather than curative, focusing on symptom relief rather than eradication. 12. Perforation or fistula formation. Advanced tumors can cause perforations in the esophagus or abnormal connections, fistulas, with the airway, making treatment extremely difficult. 13. Lack of targeted therapies. Compared to other cancers, there are fewer targeted therapy options available, limiting advanced treatment strategies. 14. Difficulty in accessing treatment. Many patients do not have access to specialized cancer centers or advanced treatment options, reducing their chances of curative intervention. 15. Psychological and quality of life factors. The aggressive nature of esophageal cancer, combined with treatment side effects, leads some patients to opt out of curative treatments, prioritizing comfort and quality of life instead. Because of these factors, esophageal cancer often reaches a stage where curative treatment is no longer possible, and care focuses on symptom management and improving the patient's remaining quality of life. Liver cancer, particularly hepatocellular carcinoma (HCC), is often considered difficult to cure because of several key factors. 1. Late diagnosis. Liver cancer often develops silently, with few or no symptoms in the early stages. By the time symptoms appear, jaundice, weight loss, abdominal pain, the cancer may have already spread, limiting treatment options. 2. Underlying liver disease. Many liver cancer patients have chronic liver diseases like cirrhosis, hepatitis B/C, or fatty liver disease. These conditions weaken the liver, making aggressive treatments like surgery or chemotherapy riskier. 3. Limited treatment options. Surgical resection. Only an option if the tumor is small and liver function is good, but many patients are ineligible due to cirrhosis. Liver transplant. A potential cure, but only a small percentage qualify, and donor shortages make it inaccessible for many. Local therapies, e.g., radiofrequency ablation, TACE. These can slow cancer but rarely cure advanced cases. Systemic treatments, targeted therapy, immunotherapy, chemotherapy. These extend life but don't typically cure advanced cases. 4. High recurrence rate. Even if successfully treated, liver cancer has a high recurrence rate, often within a few years. The damaged liver environment due to cirrhosis or chronic infections promotes new cancer growth. 5. Aggressive nature of advanced disease. In advanced stages, liver cancer spreads, metastasizes to other organs, making it nearly impossible to eliminate completely. At this point, treatment focuses on extending life rather than curing the disease. Conclusion: liver cancer can sometimes be cured if caught early and treated with surgery or transplant. However, due to late detection, underlying liver disease, and high recurrence rates, it is often managed rather than cured, making it one of the more difficult cancers to treat successfully. Lung cancer is consistently one of the top 3 deadliest cancers worldwide. Here are 15 reasons why. 1. Late diagnosis. Lung cancer often remains asymptomatic until it reaches an advanced stage, making early detection difficult. 2. Aggressive growth. It tends to grow and spread rapidly, especially small cell lung cancer (SCLC), which can metastasize early. 3. High metastasis rate. Lung cancer easily spreads to other organs like the brain, liver, and bones, reducing survival chances. 4. Limited early screening. Unlike some cancers, e.g., breast or cervical, routine lung cancer screening is not widely accessible, and only high-risk groups are recommended for screening. 5. Strong link to smoking. Cigarette smoking is the leading cause of lung cancer, and quitting doesn't immediately eliminate risk, as damage accumulates over time. 6. Environmental and occupational hazards. Exposure to pollutants like asbestos, radon gas, and air pollution increases the risk, affecting even non-smokers. 7. Poor treatment response in advanced stages. Chemotherapy, radiation, and targeted therapy become less effective when lung cancer is detected late. 8. Resistance to treatment. Many lung cancers develop resistance to targeted therapies and chemotherapy over time, making them harder to control. 9. High recurrence rate. Even after successful treatment, lung cancer has a high likelihood of recurrence, leading to lower long-term survival rates. 10. Difficulty in surgical removal. Surgery is effective only in early stages, but most cases are detected when surgery is no longer a viable option. 11. Limited awareness and misinformation. Many people don't recognize lung cancer symptoms, like a persistent cough or shortness of breath, early enough to seek timely medical help. 12. Lack of curative treatments for advanced stages. Unlike some cancers with high cure rates, advanced lung cancer is often considered incurable, with treatment focused on prolonging life. 13. Comorbidities and overall health impact. Many lung cancer patients have existing health issues, e.g., COPD, heart disease, that complicate treatment and worsen prognosis. 14. Poor prognosis. The 5-year survival rate for lung cancer is low compared to many other cancers, particularly in late stages. 15. Global prevalence and rising cases. With increasing pollution and smoking rates in some countries, lung cancer remains one of the most commonly diagnosed and deadliest cancers worldwide. These factors contribute to lung cancer being one of the top 3 deadliest cancers, with survival rates significantly lower than many other cancer types. Pancreatic cancer is one of the deadliest cancers for several reasons. 1. Late diagnosis. The pancreas is deep inside the abdomen, making it difficult to detect tumors early. Early-stage pancreatic cancer often doesn't cause noticeable symptoms, so by the time it's diagnosed, the cancer is often in advanced stages. 2. Aggressive growth. Pancreatic cancer tends to grow and spread metastasize quickly, making it harder to treat once it has progressed. 3. Limited treatment options. Surgery is often not an option for many patients because the cancer has spread too far by the time it's detected. Chemotherapy and radiation can sometimes be effective, but they are often less successful with pancreatic cancer compared to other cancers. 4. Lack of effective screening. There is no routine screening test for pancreatic cancer, unlike for breast, colon, or cervical cancers. This means many people aren't diagnosed until the cancer has already spread significantly. Due to these factors, pancreatic cancer has a poor survival rate, with fewer than 10% of patients surviving for 5 years after diagnosis. These elements contribute to it being one of the top 3 deadliest cancers, alongside lung and colorectal cancers.